Can dizziness cause acid reflux? Dizziness, unlike acid reflux, isn't a condition, it's a symptom with many potential causes. As dizziness is a symptom, not a condition, there's even less literature to suggest that it will cause acid reflux or other digestive issues. A proposed mechanism would be that dizziness is associated with nausea or vomiting, which can affect digestion, which can then lead to acid reflux. But is it possible that something else be causing both the acid reflux and the dizziness? One likely mechanism would be the joints in the neck becoming misaligned, which can start to irritate the surrounding nerves and arteries. The upper neck protects parts of the spinal cord, and sitting just above it is the brainstem. If the nerves here are irritated, it can lead to symptoms or functions being affected in different parts of the body. This area is essentially a control center between the brain and the body, a bit like the fuse box in your house. Irritation in this area can affect the vagus nerve, the dorsal motor nucleus of the vagus nerve, and also affect the nucleus tractus solitarius. It can also affect the vestibular nucleus, the medulla, or the enteric nervous system. This can result in the suboccipital muscles tightening, worsening dizziness, and affecting the pathways for digestion. The research still needs to be developed, with most linking vagus nerve compression to these symptoms, such as this study about neck-stomach syndrome, or this study which references the vestibular nuclei and digestion. If the neck is the culprit, this could be due to postures, accidents, or habits such as sleeping in a certain position to prevent the reflux, like having extra pillows which brings the neck up and more forward. If this is the case, it wouldn't mean that reflux is causing dizziness, but the adaptation of the sleep due to reflux by propping the neck up is then leading to irritation of the nerves in the neck, which leads to cervicogenic dizziness. The research needs to be developed further, but I've seen a correlation in our practice between dizziness and digestive issues, including acid reflux, where there's already been an exclusion of eustachian issues or problems with the inner ear. And for the patients experiencing this, when we start to improve the function of their neck, that's where we see this change and reduction in their dizziness and the acid reflux. Follow for more breakdowns like this.